I think one of the themes of today has been plans that don't exactly go ahead as intended. I'm happy to say we'll be able to continue almost immediately, or indeed immediately, but can I tell you why we have not started at 2 o'clock and tell you about the arrangements for recording this afternoon. Apparently, for reasons which we've yet to identify, there have been difficulties with the bandwidth which is available to transmit in ways that I can only imagine the recording to the YouTube platform, and therefore the broadcasting has been intermittent. However, our understanding is that the audio component within the transmission is such that certainly we'll be able to record everything that is said during the hearing. When I say we, I mean our technical support is working to secure the full transmission. But what I propose to do is proceed in these circumstances. Circumstances are such that we understand everything that will be said will be recorded on audio during the afternoon. The witness statement is, of course, to be, or in fact perhaps has been, posted on the website, and a transcript of the evidence will be, as is usual, posted on the website within the next couple of days. In addition to that, we will arrange for the posting of the audio recording on the website. Now, I hope I've made that clear. My intention is just to advise people where we are. I'm not looking for any, or to the extent that any decision has to be made, I've made it. We're going to proceed. But it may be that all or part of this afternoon's proceedings are not simultaneously transmitted. So with that by way of, I hope, accurate explanation, could we invite Ms. Cuddihy to rejoin us? Good afternoon, Ms. Cuddihy. I hope the reason for our delay in starting has been passed on to you. My understanding is we're having difficulty with securing the necessary bandwidth for a onward transmission of the proceedings. But the proceedings are being recorded. At least an audio recording will be posted on the website, and as is usual with all our evidence, a written transcript will go on the website. So, Mr. Duncan.
Thank you, my Lord. Molly, if we can move on then through 2018, and we start to move on with the new plan. And if we just to get us back into where we were immediately before lunch, if you look at paragraph 108 of your statement, I think you set out the new plan there, is that right?
Yep.
Yeah. And so it's a different regime of chemo, some radiotherapy, surgery after 10th chemo, I think, is that right?
Yeah.
Yeah.
Yes.
And then there would be some chemo to chase down the remaining cells, is that right?
Yes.
If there were any.
Yeah.
And do we then go into a process of kind of going backwards and forwards to hospital for that treatment, is that right?
Yeah, so I had to have radiotherapy at the same time. So the radiotherapy would be up every single day at the Beatson, Monday to Friday. And then I was still on my 21-day cycle. So that would start on the Friday for the chemo, whenever it was a chemo weekend. And I would be in the Friday overnight and through the weekend. And then I would have radiotherapy again on the Monday. That went on for 6 weeks, so 2 chemos worth. I had that kind of routine,
Yeah.
like, but at one point I did have to be an inpatient. I had mucositis, and so
Sorry, I didn't catch that.
At one point during that, I had to be admitted as an inpatient.
Yeah.
Instead of going from home every day, I was going from the hospital.
Yeah.
Because I had mucositis.
Yeah. And how did you get to and from the Beatson?
When I was in the hospital, by taxi.
Yeah. And I mean, over this period, had you any answers at this point as to how you'd got the infection, or indeed whether it had gone away?
We didn't know if it was gone away. That was certainly we hoped. I was still on oral antibiotics at this point, and I had to continue to be on them. We were still kind of at a loss for why. There was no definitive answers. It was all up in the air, really.
Okay. Now, over this period of time, I think we can see from your statement that you became aware of some other issues to do with the hospital.
Yeah.
And if we take, for example, your journeys to and from the Beatson, you remember an issue in relation to a fallen window or a sheet of glass?
Yes, so one of the days on my way back from the Beatson, the taxi driver was getting my chair out the back, and my mum was about to take me in through the front door, and the taxi driver stopped us because there was broken glass all over the floor. And it was literally just before we pulled in. One of the panels had fallen and smashed. So that was a needy.
Yeah. And another issue that affected the way in which people were permitted to enter and leave the hospital was something to do with cladding.
Yeah.
You want to tell us a bit about that?
With the issue with Grenfell, the cladding had to be changed, but when they removed the cladding, they found that there was fungal spores, I believe. We couldn't be near that because of our immunity, and so we couldn't go in through the children's entrance anymore. Obviously, the front entrance we weren't to use because of the issues with the windows and the panels, and there was a scaffolding there. And so the only entrance that was left available was through the discharge lounge. That wasn't without issues, though. That was where the smokers like to congregate. And so, unfortunately, your only option was to walk through a smoke-filled environment. And when the majority of us have got issues with our lungs anyway, it's ridiculous. I mean, the thing about children's cancers is that it's not a lifestyle choice. It's a mistake that's happened with your DNA. It cannot be helped. And these people are smoking, and the type of person that has to smoke when they're in the hospital is obviously a bad habit, and it's like a kick in the face that you have to walk through that, and you can't help the situation you're in. It's not only is it uncomfortable because of the smoke, but you don't feel good about it either.
And another issue I think that you mentioned that you were aware of, just on, I think on Ward 2A in particular, on the Schiehallion unit in particular, in the earlier parts of 2018, was a particular type of cleaning that went on using, I think, hydrogen peroxide.
Yeah.
Can you tell us a bit about that?
So there was a spray almost, so the rooms had to all be shut. And they would be sealed off, and so they were kind of constantly moving people about, and like if you didn't need to be in the ward, you were moved off the ward. So this happened while I was in for the month long. So I couldn't leave the ward because of the bug, but I think I was one of like 6 patients on the ward at that time, and we're usually overflowing and on different wards on top of everyone in our ward. So that was crazy to think everyone was displaced elsewhere in the hospital because they had to get this cleaning done. So we were kind of bounced about room to room while they did the cleans. And it was like I said, they sealed off the room, and it was this machine, and it basically like sprayed every single surface. So that was a whole performance, because then the staff, like the auxiliaries and things, they had to be moving furniture about, and that's not their job. Their job's helping to care, but they were stuck having to move furniture because a clean had to be done because they didn't know where the issues were.
What if, I mean, just thinking about those 3 issues then, and that last one in particular, where you're one of maybe 6 people in ward, everybody's displaced because this cleaning has to be done. What, if any, effect did all of these things have on your confidence in the clinical facility that you were in?
Well, I knew that I had a bug. I knew that it was environmental. We didn't know. We had an inkling it was probably to do with the hospital because of everything else that was going on with the water. But so that, I was already nervous, but I had nowhere else to go. That was where I needed to be treated. But then you throw in that everyone's getting moved off the ward, and then we're all getting moved about, so you couldn't even settle in a room. And I mean, I was in there for a month, so not settling for a few days, jumping from room to room. We had to pack up each time, and so then that's even less of a confidence, and it was very obvious that there was something wrong, but like it wasn't communicated what was wrong, if they knew anything was wrong, and so you're being dropped about room to room, and some people aren't even on the ward, and you have no idea why.
Now, did there come a point when you discovered that, in fact, the Schiehallion unit was going to actually close?
Yes.
And can you remember where you were when you discovered that?
I was in the ward. I think it was in the September. I think I had a chemo in September, and then it was to close by the end of September, and then I had my next one at the start of October, and it was in.
You want to have a look at paragraph 179 in your statement, Molly? I think you set out what you discovered.
Yeah. So I was discharged the end of September, and then everyone was moved. So it was over the weekend, I think, and then that's again another job that the staff had to do. They had to move all of our stuff over to the other hospital.
I noticed that one of the things that you say in that paragraph is what they said was that Ward 6A would be a lot better, that the issues with the Children's Hospital were not issues in the QEUH. We would be fine in Elizabeth.
Yeah.
Do you have a recollection of who said these things?
So we used to get letters, but they also used to send the nurse in charge and Mr. Jamie Redfern around, and basically they had to be the bearers of bad news, and they couldn't really answer any questions. Whether that was because they didn't know or they weren't allowed to say, I don't know. But it was quite horrible actually, because they were subjected to all of us being angry. Obviously we were angry, but they were just kind of pushed to the front, and to the rules.
Right. So what you've set out there, what you learned from a combination of, did you say, letters and what the nursing staff were being asked to tell you, is that
Yeah,
what
so the nurse in charge and of the ward, and then Mr. Redfern, I believe at the time, was the general manager.
And I think the other thing you mentioned is that you were told it would be a couple of months or so.
Yeah. We thought we would be in UA for the new year.
Do you recall anyone around about this time saying anything about whether the water supply on Ward 6A was the same as or different from the water supply on Ward 2A?
We were told it was a different water supply.
Again, do you have a recollection of who said that?
I think my dad asked the question because that was his concern, because that's where we believed the bug.
Okay, so if we move on then with your treatment, we can see from your statement that you were due to have surgery on the 19th of October 2018. It's paragraph 112, Molly, if you're looking where we are. And I think you were admitted again to Ward 3A. And can you recall if the surgery was explained to you before you went to theatre?
Yeah, so I had both my thoracic surgeon, Mr. Andrews, and my plastic surgeon, Mr. Watson, come, and so Mr. Andrews was very upfront that it was a quite a dangerous surgery. I mean, it's my chest wall, and obviously that's you need your lungs, you need your diaphragm to help you breathe and things. So, it was dangerous, and it was to be a long procedure, and they came and they spoke me through all of the everything that could go wrong, and I had to sign my forms, and I was, as much as I was nervous, it was a huge deal, the surgery itself, and it wasn't like a routine surgery or anything. It was something that was specific to me, but I very much had a confidence in them. I wasn't terrified or anything. I wasn't panicking. I 'cause it was in my head, that's what's going to get rid of this. That's the big thing that I need to get rid of. So it was worth it. It made sense to me, and because of that.
Yeah. I think you were offered a sedative the night before, but chose not to take that.
No, I didn't feel I needed it. Like I said, I wasn't too concerned.
Now, you're on Ward 3A, and you explained earlier, it wouldn't be under the usual Cuddihy protocols there,
No.
is that right?
No, I wasn't.
And does that mean that your temperature wouldn't be regularly checked?
No, it was checked when I was admitted as part of the patient check-in, but it wasn't done again.
And physically, were you starting to exhibit some symptoms of some kind?
Yeah, so I couldn't sleep that night, and it was almost as if I was shaking. I now know it to be writing, but everyone thought that it was because I was nervous about my surgery, and so I was given a sedative that I had previously been offered, but it didn't make a difference, and like I said, I wasn't feeling overly anxious in any way, so there wasn't really an explanation for why I was shaking the way I was.
Yeah, presumably if it had been nerves, the sedative would have dealt
Yeah.
with that.
Yeah.
Now, am I right in understanding that shortly before you were due to have the operation, you did have your temperature taken?
Yeah, so they have to do final checks before you go into surgery, and one of them is so you get your heart rate, your blood pressure, and temperature taken.
And what did that show?
It was over 40 degrees, and so that kind of explains the shaking the night before to be Riger's, and it was the early onset of whatever was going on.
Yeah, and what decision was taken in relation to the operation at that point?
The anaesthetist came and spoke to us, so it was her decision. and she came up and her exact words were that she couldn't go ahead with the surgery because if she did, it would have been catastrophic if something was on board and they hadn't known. Because obviously I had to be on a ventilator during surgery and I wouldn't have been up from that.
And were cultures taken again at this point?
Yeah. So the cultures were taken and tested, and I was then admitted to 6A.
And how quickly did the cultures come back?
I think it was only about 5 days this time.
What did they show?
Mycobacterium colonae.
So it was back.
Back.
And did you have a meeting with any of the microbiology staff around about this time?
Yeah, so then Dr. Christine Peters took over from Dr. Inkster, and I had a sit-down meeting with both her and Dr. Sastry.
How did that come about?
I asked for it. I was over 16 this time, so I asked to be present for it.
And what did Dr. Peters say?
So I asked her what could they tell me if it was actually going to be gone this time. What were they going to do for me? And she was very upfront that she didn't know if it would be gone. But they've had a number of antibiotics that they were just going to work through, and they were going to try again. And this time they were going to do the 2 months IV because they only did the month previously, and it clearly never worked.
This would be different antibiotics?
Yep. They believed that the bug would have now been resistant to the antibiotics I had before.
And what were those antibiotics like?
These were worse than the last ones. They were for leprosy patients. I thought it was probably the last time that I was really sick this time. I was confined to my bed for the 2 months, effectively.
And your line was removed again, is that
Yep.
right? So let's move on then with plans. So Dr. Sastry's,
Yep.
what was his new plan is now being ripped
Now
up, is
can't
that
go
right?
ahead. Yep.
So did he come up with a new plan?
Yeah, so we were just going to do the last 2 chemos that I would have had, and the surgery would be at the very end. But that was a concern for me because when the first time they had to change the plan, it was explained to me that I would have the surgery prior to the last 2 chemos in order to sweep up the remaining cells. This time that wasn't the case. And so that was playing in my head and what's cleaning up anything that's left from surgery. But I didn't have an option.
Now, were you an inpatient over this period then of,
Yeah.
and there was this antibiotic treatment and chemo in tandem?
Yeah, so the antibiotics started, and then eventually I started and I had the last 2 chemos.
And where were you while you were an inpatient?
6A.
Right. Let's pause then and start to think about Ward 6A, and I just really want to get your thoughts on the comparison between Ward 6A, Ward 2A.
So we spoke about before that Sarah and I had identified the gap in the provision for that age group. But not only was it missing for them now, they had taken away the playroom. There was no playroom for the kids. There was no TCT. There was no longer a parents' kitchen. We didn't have the TCT kitchen. Even the way the ward was set up was completely different. You were then in hospital, and daycare had to be on the same ward, and so everyone was going by your room to get to daycare because daycare was at the very end of the ward, and so every single person that has to come in has to walk by you. And when you're feeling rotten, you don't want people looking in your room, but it's human nature that people are going to look in the window as they pass it. It was unavoidable.
I mean, so as a result of all of those facilities that you previously had not being available to you, the TCT room in particular, were you stuck in your room basically?
Yeah, completely. And they weren't. You were allowed to like go a walk around the ward, but you were getting in people's way, and Like the nurses are already incredibly busy, and you're not one to get in their way, so you really couldn't do anything but leave your room.
What effect did that have on you?
I felt sick that time. That's when that mentally, that's kind of when I went downhill a bit, and eventually I gave in at this point and got a feeding tube.
I mean, what you've just said is more or less what you say at paragraph 155. You say, for a lot of us, sick was a mindset.
Yeah.
It was easier to believe you were sick when you were bored sick.
Yeah.
And have you just told us that finally gave in and you had a feeding tube?
Yeah, because there was no way of there was no way of getting food, and we had a microwave for a very, very small period of time. I think it was maybe a week. We had this microwave, but you had to ask a member of staff to use it for you, and they would do it at night, but then you were bothering them, but then it was taken away, so we couldn't even use it, and we were told that we had to go downstairs if you wanted to reheat food. So if my mum wanted to heat up something for me, she'd have to walk through the entire hospital, go down to the atrium, and use microwaves that they were unclean, completely unclean, and then bring that food all the way back back in the lift up to 6A. And surely, to me, surely that is more of an infection risk than having one in the ward that we're solely using. But it's people above my station that make those decisions. So it's I just didn't want to eat either, because I just hated it. Absolutely hated it.
Was Ronan on the ward?
Yeah, Ronan, but his job was then so difficult. Like he didn't have a common space that he could help people. He couldn't introduce people because you're not allowed in someone else's room, and he had to like bounce between rooms. And then there was only like one movable PlayStation, so if one person had it, then that was it for everyone. And I mean, I never needed it, but it was horrible for anyone that was newly diagnosed, because they didn't know any different, and they didn't have people that they could still contact or anything. And Ronan tried his best, and it did make all the difference in coming in and speaking to you and trying to organise things for you, like my guitar lessons, that side and things, but it just wasn't the same.
But was he having to do that essentially on a patient-by-patient basis? The group activity aspect kind of
that
gone?
was all gone. No socialising, no nothing like that.
And do you feel that the support network that you had effectively gone too?
Yeah, it fell apart completely.
What about the charities? Were they able to get access to the ward?
Not in the same way. No. Team Jack just had to leave things. Eventually, what was a bathroom got made into a parent's kitchen. Towards the end of the time, but it was like a trolley could perhaps go round, but there wasn't really anything that they could do. It was a different place. It wasn't a happy place anymore. It completely changed from that safe haven that we were used to.
You mean, when you say people, do you mean only the patients? Do you mean the patients and the families, or do you mean the patients, the families and the staff as well?
Everyone, it was easier for the nurses in the sense that, so if the emergency buzzer went when we were on 2A, because of the circular, it was like kind of like this shape. They would be running around the corner trying to find where they were going, and obviously that's a lot easier on the straight ward in 6A, but you could see it affected them, that everyone else was affected by this move, and people weren't happy the same. And it was so heartbreaking walking by the wee kids' rooms, and they're just at the door, and they're just looking at you through the door, and it's like you're used to seeing them running up and down, and that's horrible.
Speaking of rooms, what about your bedroom in 6A? How did that compare to what you'd had previously?
It was they looked like hospital rooms. Because it was an adult ward, it looked like hospital rooms. Like the colours and everything was a lot nicer and happier. And I know that doesn't sound like it makes a huge difference, but when you're staring at four walls all day, it does make a difference, whether it's a coloured wall or whether it's a blank wall. And they tried to fit up stickers, but I know one time when I was on medication, I was hallucinating with these stickers. They weren't particularly nice stickers, and a lot of the kids agreed with that, but that was the best they could do. And it was, even with the parents' bed, so the parents, they used to have pull-down beds that were built into the furniture, and that because they could pull down, there's a proper mattress. But these beds were like, these new ones were folded, so a proper mattress shouldn't be old, the one that supports you. So then people, like your parents, were staying in these beds, and they're already up all the time with us for our machines and need help for the bathroom and things like that. That need a decent bed. It's just it was a completely different environment.
Okay. Let's move on to another aspect of 6A. Let's just think back to that conversation that you'd had before you moved and what you were told about the fact that there would be the issues that were present in 2A wouldn't be present in 6A. Is that how it turned out?
No. Turned out to be the same water system. We also still had filters all over the taps, and that was there from the get-go. So for something that was supposed to be a different water system, why did we have filters? I mean, it was obvious.
I mean, how were you finding out what was going on generally in relation to hospital at this stage of things?
My dad had started pushing for things after I got the bug, and a lot of the answers that I had, and certainly from my general understanding, was through my dad and any work he was doing. But there were still some letters, and like I said, they used to send management round, and it was what I was finding out through my dad and what I was finding out when management came to speak to us were completely different things. And that wasn't fair, because not everyone had that. Not everyone had like a parent that could push for them. I was very, very lucky because of that my mum and dad were pushing for that on my behalf, but not everyone had that. So why was the same information not afforded to every single patient? And why was that being withheld from the staff? So it was just a breakdown completely in trust and everything.
So you would go as far as that was a breakdown in trust by this stage?
Yeah.
Let's take an example of where there maybe be different stories about something. Paragraph 180 of your statement, Molly, you mentioned something about the staff kitchen. 6A?
Yeah.
You remember that?
Yeah.
Want to tell us a bit about that, or take a moment to refresh your memory?
Yeah. So the staff kitchen, which is where the microwave that we had for about a week was, that was suddenly one day. So the room that I was in for the majority of the 2 months was across from this kitchen, and one day it was suddenly taped up with a big orange tape that was there for the HPV cleaning. So it was completely sealed off, and we were just told that it was getting redone. But when you actually spoke to the nursing staff and some of the auxiliaries, which we had a good relationship with, found out that it was because there was mould when things were taken up, and it was bad. Then there was pictures of it, and that's a hospital.
In your what you say, paragraph 180, is the way you put it is the higher up staff. They told you that they were just rejigging.
Yeah, that it was just getting done up.
Who do you mean by or what do you mean by the higher up staff?
Like the management team. So kind of the non-clinical staff.
Yeah. So their explanation of things was we're redoing or rejigging the kitchen.
Yes, upgrading
Yeah,
is
upgrading
their
it.
favourite word.
Whereas the auxiliaries were saying, actually, no, there's a problem in here.
Yeah.
Okay, let's move back to your story then. Treatment in late 2018. Am I right in understanding you still have this issue with your heart that you had?
Yeah.
Yeah. And am I right in thinking that when we get towards the very end of 2018, you discover another issue that's arisen from the antibiotic treatment to do with another organ?
So after every second chemo, I was having my kidney function tests done, just to keep an eye on things, and it maintained throughout all of my chemotherapy at 98% function, which is perfect. It's ideal, what you want. And then all of a sudden, so for the chemos before those 2 months of IV antibiotics, it wasn't 98%. And then when I got it tested again after the end of the 2 months, that all of a sudden my kidney function was down to 54%. So it halved, effectively.
Yeah. Looking at your statement again, Molly, at paragraph 123, just to try and bring us up to the end of 2018. You got that in front of you?
Yeah.
Just interested in what you say, paragraph 123. You say, it was hard to feel completely safe at that point. It was nothing to do with the clinical staff because I trusted them implicitly. Just pausing there. Is that right? Even at this stage, you still implicitly trusted Dr.
Completely.
Sastry and his team?
Oh, 100%.
Yeah. You then say, I knew the best care. I could only put my trust in them, but I would have had to be blind not to see building it. Is that right?
Yeah.
I mean, when you say I would have had to have been blind, I mean, anyone would need to be blind to see that there wasn't an issue here.
Yeah.
Do you think that the obviousness of that was reflected in the messaging that you were seeing coming from the Health Board at this point?
No.
Are you aware of any messaging from the Scottish Government at this stage in relation to the issues that you were seeing?
So my dad had been in contact with members of the Scottish Government the first time. Contacted the Chief Medical Officer during the summer months. So I was aware of things in the background running that way. I wasn't too involved in any of that. I tried, because I was so acutely unwell, I had signed off because I was over 16 that my dad could deal with things on my behalf so that we could kind of keep them separate. So I was aware, and my dad always informed me of everything, but it was easier for me to try and maintain that trust when I kept that in the background.
And I suppose, going back to your story again, another thing that you were still focused on were your own plans, and you're pushing on with the hires now, is that right?
Yeah, I was doing my hires.
But were we right in understanding that those had to be scaled back a bit because the simple fact was you were in hospital and couldn't do science experiments, for example?
Yeah, so I had originally set out to do 6 hires, and it took a lot of work to try and get people to agree to let me to do 6 hires. But it was fine, and then got the bug, and it meant I wouldn't be in school, and so that meant that I couldn't do. So in order to meet your qualification, you have to do an assignment, and part of that is an experiment. Now, I couldn't get into school to do the experiments, but I also was like the chemicals. I could have had an issue with them, and so I couldn't sit biology or chemistry, which are fundamental if you want to be a doctor. So there was no point in studying them. And as for maths, I continued to study maths. I enjoy maths, but there was no point in me sitting the exam because I was planning to do the advanced higher. So we scaled it from 6 down to 3, and I just continued with Spanish, French, and English.
Yeah. I've no doubt we'll come back to that later. Let's move into 2019 now, Molly. And I think finally the surgery took place. Is that right? I think we can see it was the 16th of January,
A year to the
2019. Is that
day.
right?
Yeah.
Ward 3A again?
Yep.
Same operation that you were going to have before, is that right?
Exact same.
Yeah. Was there an issue with pain relief?
Yeah. So in October when I was supposed to have the surgery, there was a bed in PICU for me for afterwards because of the pain relief I would need, and just in case there was issues with my breathing as well. There was an issue with availability of PICU beds. This was a UK wide kind of thing. There was an issue with PICU everywhere, but because I wasn't acutely unwell, that I thought, right, okay, well, I could maybe go without the PICU bed. So I went back to 3A. However, because of that, the idea for pain relief changed. So I was to have I've forgotten the name of that. An epidural in my back, so that I couldn't feel anything from below a certain point, so that they could cut down on pain relief, because teenagers don't do well with morphine. I particularly don't. It makes you quite violently sick. And because I'd had surgery on my chest wall, I couldn't afford to be sick in case I did anything in that area. And so I couldn't be on morphine, and that was the only available drug that you could get on PCA and 3A. So that was fine because we expected the epidural to work. However, because of the tumour in my spine, the epidural didn't work, and I could feel everything. But there was still the issue of I can't get morphine and there's no other PCA, so that we tried everything. And this went on for 2 days. I was keeping on trying, and eventually it ended up in a screaming match out in the corridors because the doctors from Cuddihy came up and shouted with management that it was inhumane to leave me in the state I was in without pain relief. So it was agreed that I was what they called specialed, and they had the very first night it was a nurse from PICU, but after that it was Cuddihy staff for the remainder of my time in 3A, and I had a one-on-one nurse so that I could get ketamine PCAs so that I had pain relief.
Yeah. Yeah, so you said you went about 2 days without pain relief, is that right?
Two days.
Yeah. Scale of the pain?
That was the first time I've ever used the number 10.
Now, move into February. Have clear scans, is that right?
Yeah. I had finished my treatment, so I got to ring the bell.
Well, tell us about that.
So my friend that I went through treatment with, he was a patient at Dr. Sashi's as well, and the two of us luckily managed to ring it together. So it was a big deal, and we went up to Cuddihy, and it's the nice thing about Cuddihy that's different from adults is that it's an end of treatment bell, not a cured bell. So regardless of what your outcome's going to be, you can always ring it. But I had finished all my treatment, and that was me clear scan. So I went and I rang the bell, and it was like a big party. It was hard enough.
Yeah, people get to say a few things, is that?
Yeah.
However, you're still being treated for infection, is that right?
Yes.
You're still on the antibiotics.
I wasn't officially discharged.
Yeah. And, I mean, you didn't have a line at this point, did you?
No.
These intravenous antibiotics?
No, they're oral antibiotics at this point.
Were there any injected ones over the period in early 2019?
No.
But I think, am I right in understanding that eventually Dr. Sastry and Professor Lawrence agreed that you could stop
Yeah, they kind of said enough's enough. By the summer, I was so poorly on them, and I had so many issues, kind of my gastro system, that they said that the benefits aren't the cons outweigh the pros kind of thing. So they agreed to take me off them in the hopes that the bug was gone.
And by July 2019, did you have some other plans underway?
Yeah. I had got into Cambridge's summer school, and I went down and did a medical induction course.
Yeah. How long did that last?
2 weeks. Yeah, so
How did it go?
yeah, good. I got a first. So
Yeah.
good. Enjoyed it.
I think in July 2019, you also had a consultation with Dr. Sastry.
Yeah,
And I think you
so
probably know the one I'm referring to, is that right? Now, I wonder if we want to just get your statement up. Quite a lot in this. Paragraph 128. So just use, I think if we did have that up on the screen, it might help. It's page 36. Thank you very much. Excellent. So, just have a moment to look at that, Molly. Is that is the meeting in July 2019 that I was asking about?
yeah.
You want to tell us a bit about this?
So we believed it to be a routine checkup, and I was well at this point, and so when my dad was back at work, he was away on a trip, and my mum and I just went up for my checkup. At the end of it, doctors actually had us sitting in the doctor's room, which was unusual. He had to talk to us about something, and I was in nettles that it was.
Sorry, Molly, I missed that.
I was worried that it was my cancer or something. But he sat us down, and the way the conversation kind of went was, he said, "And you're aware that someone else has contracted Mycobacterium coli?" And we were like, "Well, no, we weren't aware of that." And so Dr. Sastry was very taken aback, because he was under the impression that we had been told and we knew that this had happened, and it was promised it wouldn't happen. But of course it did. It was written into, so the infection management team had a meeting after the patient contracted MC, and it was written into the minutes of the meeting that Professor Cuddihy was to be informed of what had happened. And then it had been written in the following meeting that he had been informed and that had been done, but it hadn't done. And in fact, it was Dr. Sastry that told us, because he believed it was important that we knew. But whilst we were in that meeting, he got a phone call from a member of the management team, and he said, "I'm actually in with Molly and Mrs. Cuddihy just now, and I've just told them." And he had to leave the room to speak to them. He didn't speak to them in front of us. I don't know what was said, but he was asked to leave the room.
And how did you feel, the disclosure of all of this?
I was horrified, because you build relationships with all these kids on the ward, and so I had all my friends that were my age, but not only that, there was the wee tots that that was in my head, that one of these wee kids has got this bug, and I remembered how awful I felt. So I was absolutely horrified that I kept imagining one of the wee babies had this bug, and I'm not saying that it's any worse that a younger child's got it than an older child, but it, no matter who it is, it's horrible. But it's just that's all that was in my head. No matter, I felt like it was something, and I know it's not. I felt like it was something that could have been changed if it was done differently. If I had done something differently, and I know it's nothing to do with me, but that all could have been avoided if the right measures were taken at the time that I had got that. That would have been avoided, and that was one less person that was sick.
I mean, I think you go on to say at paragraph 132 that you were angry.
Oh yeah, I was so yeah. I just felt like that was when I wanted involved with what my dad was pursuing, because it just wasn't, they weren't listening. If it had gotten to the stage that someone else had contracted it, they clearly had listened the first time. And I'm not saying that I could do anything differently than my dad, but I just wanted involved.
Were you upset that your father hadn't been told as they had?
Yeah, yeah. I was more angry that it was then said he'd been told, so they'd updated their minutes that he had been told when he clearly hadn't.
Thank you. We can put that to one. Now, I think we know, Molly, that you relapsed in August, unfortunately. Had the infection impacted upon your treatment options?
Yes. So because of my reduced kidney function, that reduced my options. There was kind of like 3 options I was given from the get-go. So the very first thing they did was I had an operation to remove the biggest tumour that was in my lung. But then thereafter, it was Dr. Sastry gave me 3 options. The first of which was I could kind of go on a maintenance chemo, and that would buy me time. Obviously that wouldn't have been curable that way. That wouldn't have been enough to cure it. So to me, that was given up. Yeah. So that was crossed off. I could have also tried a different chemo that was a bit more heavy duty, but it wasn't a guarantee, and I wanted something that they thought, right, okay, the third option was, now thank God for Dr. Sastry that he had the foresight to think of this. But the third option was the heavy duty chemo and the stem cell transplant, and that was Mimi. So it was, they would do that twice, basically, they called it. But the risks of that were I wouldn't make it out of it because of my reduced kidney function, and not only that, how horrible the treatment was itself.
Yeah. As you put it in your statement, of course I was going to try.
Yeah.
But you did, am I right in thinking you did the maintenance as well?
Yeah, so I wanted to get the fundraising out of the way. The way I saw it was, if, God forbid, anything happened and I did the Mimi protocol, I'd done something good. So I got the ball out of the way. Okay,
well, we'll come to the ball later. I want to just finish 2019 because am I right in thinking that one of the other consequences, well, let's a step back. We know that one of the consequences of the antibiotic treatment was the impact on your heart. Is that right?
Yeah.
Am I right in thinking that one of the consequences of that was you couldn't have certain prophylactic antibiotics in relation to particularly the risk from fungus? Is that right?
Yeah, so it wasn't so much that I couldn't have it, it was that they had to minimise the amount of medications I was on.
Right.
And so, because I was going on this maintenance chemotherapy, Dr. Sastry made the decision that in order to try and protect my heart, and it was the plan that I was not going to be near that hospital, and that's the way you put it. You're not coming up to the hospital. We don't plan on you being here. So I was taken off of the antifungals, the prophylaxis, and it was the fluconazole and antifungal. And unfortunately, things never quite work out with me. So I did end up, not only was I going back and forward for checkups, I was an inpatient twice whilst I was on the maintenance chemo. The consequences of that were in November. So I had gone to, it was the first kind of concert I was going to on my own with my friends, and I couldn't breathe properly, and my friends took me. One of my friends took me home actually because they thought I was just panicking that I was around so many people again after being out of things for a while. But I now know that it was because of my lungs. But basically, I had PCP pneumonia. But when I was first admitted, it took a while for us to kind of get to the bottom of that. But progressively, my breathing got worse and worse until one night I got admitted to PICU, and that was the first time I was in PICU. They at first they thought it was a blood clot in my lungs, just because of the way I was reacting. I just could not get a breath, and so they had to move me down to get me onto high flow oxygen because there wasn't enough oxygen up in Schiehallion. Whilst I was in PICU, they made the decision to do a bowel test. So, bronchoalveolar lavage or something. It's a very, very invasive test. So they were going back and forward whether they were going to do it or not, because usually someone is under general anaesthetic for it because of how invasive it is. It's basically they put a tube down and it goes into your lungs, and they put fluid into your lung, and then they aspirate the fluid so that they can test it for whatever's in your lungs. But I had to be awake. I couldn't afford to intubate me because I wouldn't have come around from that. So I had to have that done awake. That was horrible. That felt like drowning, if I'm honest. That's probably the worst test I've had. But that it's just another thing. There's just so many. At this point, I was just getting fed up, I think, than anything. But from that, we found out it was PCP. We could read it.
PCP, I think, pneumocystis pneumonia, cystic, something like that.
Something, yeah.
Yeah, and do you know what causes that?
Fungus.
Yeah, I mean, in fact, did Dr. Sastry have a conversation with you about the cause of it?
Yeah.
What did he say?
It was probably because I wasn't on the prophylaxis.
Okay, so that's the story of your treatment 2019 and the many problems that you faced, but let's talk about your other plans. In the autumn of 2019, you arranged, along with Sarah, the Every Thank You Counts ball. Speak about that later. Am I right in thinking you got out from hospital 27th of November? That'd be after the PCP incident?
Yeah.
And did you have something called respiratory physio?
I did.
Why did you do that?
My make-a-wish was to, like I said earlier, my favourite singer of all time is Paolo Nutini. And so I asked for my make-a-wish if I could sing a song with Paolo Nutini. But they went above and beyond that. They had me go down to London to record in a studio with them, and I got to talk to him all day and sing as many songs as I like, and I got to hear a song off his new album and add piano to it and everything. It was so, because I was having to sing the physios. I mean, I don't think that they've ever had a request quite like that I need respiratory physio in order to be able to sing with Paolo Nutini, but he did it for me. And I got out and I did that just just before Christmas.
And I think, we're right in understanding from your dad's statement that you also went for an interview to Edinburgh University around about this time.
Yeah, I was crawling basically. I don't know why I did it, but I got an interview for medicine. Despite not doing my sciences at higher, I did get an interview. Didn't get in, but I got the interview. So I went to that after my spelling PICU.
Okay, let's move into 2020. I think it was a family holiday in Dubai, is that right?
Yeah. So we hadn't had my kidney results back yet. If my kidney results had dropped, then the Mimi wasn't an option anymore. And so Dr. Sashi told us to spend some time as a family. So we went to Dubai.
Enjoy that?
Yeah. Loved it.
And as it happens, when you came back, you got good news about the kidneys, is that right?
Yeah, when we came off the plane, we had a voicemail that my kidney results 2% better. So I got to have my transplant.
And you had a line fitted, and then you moved
The
on
next
with
day,
the
yeah.
stem cell transplant, is that right?
I did, yeah.
Was there a discussion about where that would happen, where you would be admitted to? Remember that?
Yeah, so we wanted for me to go into, and Dr. Sashi was trying to get me a bed in 4B, which was the transplant ward. There wasn't a lot of beds, and so the argument was that if I wasn't having a donor for my stem cell transplant, then I didn't have the risk of graft versus host disease and things. So did I really need one of the beds? But all of the medical staff were kind of saying to us on the side that they think that we should really push for one of those beds because it had a different air system and everything. It was a completely different ward and it was safer. So I had my conditioning chemo on 6A, but then I was moved down after things started to go downhill.
Yeah, now speaking of that, I think, am I right in understanding that one of the chemo drugs you were on as part of the process was once again the etoposide phosphate, is that right?
Yep.
Is that pretty heavy duty?
Yeah.
But was there a problem with it on this occasion in particular?
I was given an overdose of 14%.
And what was the result of that?
I deteriorated very quickly. Whether it basically because I didn't pass away, there wasn't a post-mortem, so we can't say for sure that's what did it. But my mucositis, the doctors said that was the worst they'd seen. This is horrible, and I do apologise, but I actually lost a whole chunk of my tongue. It just burnt everything all the way through, my stomach and everything. I also ended up with what they thought was veno-occlusive disease, which is an issue with the liver, with clotting in the liver. We don't think that's what it is anymore because I've been left with permanent liver damage. But because of not only the pain from the mucositis but my liver, I was on my pain relief just had to keep getting upped and upped and upped, and it got to quite a dangerous stage, and I had a spell of delirium. The very first morning of me being in ICU, so I'd stayed the Tuesday night and Wednesday morning and I had delirium. But delirium's probably too light of a term for it. I just had a complete and utter breakdown. They actually had to put me to sleep, get me to stop. But I had it in my head. With the medication messed me up completely. But everything was building up, and this was all playing in the back of my head. And then I found out about the overdose, and that was kind of like the last straw for me. And it all got muddled up. So I just, I thought that like people were out to get me, basically because of the amount of pain relief I was on. And I decided that, and to stop other people doing it, I would do it myself. So I tried to pull my line out. And if my mum hadn't noticed and pinned my arms down, and it took my mum and like so many members of staff to actually pin me down until they could knock me out with propofol, get me to stop. And I didn't recognise anyone in the room. I didn't recognise my mum. The only person I recognised was Boo Boo, one of the doctors from Cuddihy. It wasn't until he came in that I calmed down, really. But it was a complete breakdown. Dr. Sashti actually couldn't come in the room because he felt that it would just ruin the trust, because I thought that no one was on my corner, basically.
I think, am I right in understanding you've had a bit of advice around this event and how it arose?
Yeah.
As you're describing, a sort of system overload is really.
Yeah. So it's something that I always come back to with my psychologist, because it's the thing that always gets me the most, that much happened that had such a knock-on effect. And I understand that the pain relief obviously exacerbated it all, but the fact that it was affecting me that much, that I had that reaction, just that really upsets me, and it upsets me what I tried to do, because it just freaks me out that, because when I'm not on medication, obviously I would never try and do something like that, but when we've tried to explain and understand why I did it, that's the best way that we've gone. It is, it's like system. I had enough, couldn't take it anymore.
I expect most people would have said that a lot sooner than you did, Molly.
I took the extreme way to say I'd had enough.
So we move on just slightly from there then. You mentioned that there's a problem with your liver and you needed platelets.
Yeah.
Was there an issue there?
I was getting platelets sometimes a few bags a day, and because they had to be so fresh, I had to just keep putting them up. But I then started taking temperatures again, really high temperatures, like I was taking when I had the bug. And they were trying to get to the bottom of it, and they found out that one of the bags of platelets had the acne bug in it. But because I'd had my transplant and they had to bring me to zero, that obviously it was a lot worse in my system than it would be for a healthy person. So I ended up really poorly with that as well. But so this is where my dad and I disagree. So the Dr. Sashti was away at that point, and the doctor, the consultant that was in charge, made the decision. He is his duty of care, decided not to tell me that that's what had happened, that I'd probably had enough at that point. I disagree, because I think that thinking I had the bug back was even worse of an effect. But my dad thinks that they took the right decision, so we tend to disagree a lot on that. But I mean, like I said, it was just yet another thing. It just didn't seem to stop.
And I think just to complete the picture, you had a year post transplant, and I think you've recently had a bit of radiotherapy. Is that right?
Yeah. So in the summer, I had what we believe to be a dead tumour that I'd had for a while, but unfortunately it grew, so I had to have a bit of radiotherapy over the summer. But I mean, but I found out today, not officially, but just earlier on, that it doesn't look like anything's extras there. So it seems to have worked.
Good. Well, that really completes the story of your treatment, and I was going to move on now to ask you some questions, just to get your reflection on some things. Now, it's 3:25. We may or we may not finish this by 4 o'clock. I'm not entirely sure. How are you doing? Do you want a wee break?
Is that okay?
It is okay.
Absolutely okay. I think again we're talking about 15 minutes. If that works, right? We'll rise for 15 minutes. Sir Duncan.
Lord. Molly, we move towards the conclusion of your evidence, and I want to get your reflections on some of the things that you're thinking about. And we won't be looking at your statement in relation to this. We've already got your position on most of this, but I just want to maybe get some additional thoughts. First thing I'm going to ask you about is communication. And the first thing I'm going to ask you about that is, what are your views on clinical communication in the hospital?
I had no issues whatsoever with the clinical staff's communication. Like I said at the start, it was personal. It was always adapted to the individual, and it was kind. And they were upfront about everything. If they didn't know something, they told you that.
What are your views about communication about the hospital?
Dysfunctional, say disjointed. There's not one clear message. It's mixed up. It's not consistent. It's comes from different people. It comes in different ways. Sometimes you hear it on the news before you hear it from them, and majority of the time you don't hear what's actually going on.
I mean, we've gone through your timeline. I have been looking at Molly's story and I've been looking at the hospital story, but the truth of it, that they are just the same thing. I mean, do you see communication about the hospital as being somehow different and outside of communication about your clinical situation?
No, because it impacts on it.
Let's move into the detail then and think about communication with you about your MC section. June 2018, very start of June 2018, already told us, Dr. Sastry, I think the way you put it is completely upfront about what he did know and what he didn't know, is that right?
Yeah.
And you had a conversation with Dr. Peters, your parents had a conversation with Dr. Inkster. And would you say that, as far as you're aware, they were also upfront about what they did and what they didn't know?
In June, no. That was before there was a lot of answers. So the meeting with Mum and Dad. I know certainly there was things that my parents had to chase up from that. So I don't think that was up front. No, I think Dr. Peters was up front. I think they learned in that sense for the second time, but it wasn't the same.
I think something we'll come back to that you've touched on already is that one of the things you were told at the start was this was, as far as they were aware, the first instance of this infection in the hospital. Is that right?
Yes.
Yeah, come back to that. Am I right in understanding that at some point, around about September 2018, there was some sort of acknowledgement about what had happened? Is that right?
Yes. So there's a letter from the head of the board apologising for my hospital-acquired infection.
Yeah. Into the following year, I think by this stage, as you've already told us, your father has asked that he wants to be told if there's any further recurrence anywhere in the hospital of this. Is that right?
Yes.
And that, as you've said, is because, among other things, you're worried not just about yourself, but you're worried about your friends. Is that right?
Yeah, and even just my friends, the patients.
There is another infection, and that's who's not passed on initially. Is that right?
Sorry?
There was another
yeah.
instance of MC 2019, and as you've already told us, that wasn't passed on to you. That's right?
Yes. Yeah.
And again, it's in fact Dr. Sastry who provides the information. Is that right?
Yep.
Fast forward to 2021, and you are part of and you see the independent case note review. Is that right?
Yes.
And you've set out your reflections on that, beginning at paragraph 188 of your statement and paragraphs 191 to 192.
Sorry.
Do you want to have a wee look at it? we just look at the conclusion of paragraph 188, the biggest thing for me was that the report also said that I wasn't the first case. We were always told right from the start that I was. It was a case earlier than me, so that damaged my trust in the hospital for a while. So what you've been told 2018 was in fact incorrect, is that right?
Yes.
And what did, very broadly, what did the report say about the connection between your infections and the hospital environment?
Couldn't conclusively say that that's where it was from. They could say that there was a certain belief that that's where and it could come from, and it also said about how there were samples found of mycobacterium on ward 2A in rooms that I had previously stayed in a lot, that I spent the majority of my time in. And the report went on further to say that perhaps if they had looked at the time of my infection, then they would have found it in order to be able to link it, but they never took the samples.
I mean, reading the report, how did it make you feel?
Really angry, because that was yet another thing that was hidden and wasn't told. It's just...
Okay, so step back a bit, just at the overview of all of that. How would you assess the effectiveness of the hospital's communication with you on your MC infection?
dysfunctional. It was lacking. It's just it wasn't. If someone's made a mistake and they say, "Look, this is what's happened. We're sorry that this has happened, but we're going to try and find out why it has happened," then you're a bit upset, but you want to get to the answer, so you get over it. But this is consistently, it's like people trying to cover their own backs and tell you a wee bit at a time, as much as they absolutely need to in order to get you to shut up for a while. And it's samples not being taken and things, that it's unfair that they can't, because there's no samples there. Now, I'm not saying that those, if samples were taken, that it would definitely say that that's where I got my bug, but no one bothered to take the samples to look, to see. Surely, in my opinion, if I wanted to prove someone wrong, I would take the samples and make sure that it didn't come from there. Why didn't they take them?
Still on the subject of communication, I want to ask you a wee bit about prophylactic medication. We've already touched on that in your evidence, in particular in relation to the conversation that you had with Dr. Sastry. And was that again another instance of Dr. Sastry being absolutely upfront about why he thought you had developed the PCP pneumonia? Is that right?
Yep.
What about prophylactic medication more generally? Was that something that you were told about at the time?
Yeah. So at the very start, when I was first diagnosed, so everyone is put on otrimoxazole, and depending on your age is how often you get it. But I was under the impression from the very start, and I don't know. I don't know if this is the case anymore, but I thought that was just a standard for treatment, that everyone's on this antibiotic. But the more and more kind of prophylactic this medication that you're on, the more you think, is that actually standard? And it was never fully explained that was standard. You just put on it. And so then I was also on Conazole as my antifungal, and then I was on ciprofloxacin, which is another antibacterial one, and was on voriconazole pre and post transplant, because they thought that was another thing they had to cover me for. And Dr. Sastry always told me that he was making sure that I just didn't get anything else, and that was why I was on it. But I don't think other people were necessarily worded the same.
Yeah.
I don't know.
Now I want to go on and have you think about another aspect of communication, and you touch on it in your statement, and it's candour. What would you consider candour to be, or the duty of candour to be?
The responsibility of the both clinical and other staff that work in the hospital to kind of exercise their due diligence, if you like, about what they tell you and why they tell you it.
Yeah. Is it particularly engaged as you see it when maybe something has gone wrong? It's about being open with the patient, is that?
Yeah. Even if it has an effect on themselves.
Even if it has an effect on themselves?
Yeah.
Yeah. Okay, let's look at it this way. Think about all the things that you've told us today in your statement. I'm going to ask you this question. We'll go through each of them. And the question overall is this: how many times would you say that Dr. Sastry or the other clinicians sat down with you or your family and put their hands up and said something had gone wrong? Or let me put it another way, was there ever any instance where they didn't do that? Let's look at them. We go for the number one, the MC infection, indeed the return of that infection. Response of the clinical staff was to tell you exactly what had gone wrong and what they knew and what they didn't know. Is that right?
Yep.
Secondly, what might be described as the near miss in the operation in October 2018. Again, were hands put up and said, this is a return of the MC infection?
Yes.
Third one, PCP pneumonia infection. Dr. Sastry, the hand up again and says, this is because you've not been on prophylactic antibiotics, is that right?
Yes.
Fourthly, the failure of the pain relief in January 2019, was that something that was acknowledged?
By the medical staff, yes.
Yeah. Fifthly, the chemotherapy overdose, again, Dr. Sastry, hand up.
Came in on his weekend.
And the only one I think maybe where you would disagree with your father on, I think, is the last one, the sixth one, the infected platelets, where one of the doctors decided not to tell you there and then. Is that what the call was that he made was?
Yeah, and then Dr. Sastry said when he was back.
And the doctor that decided not to tell you there and then, I mean, was that to cover his or her own back?
No, it was, I think it was because of my response with the delirium.
So that was a call that that doctor made in good faith and based on what that doctor thought were your best interests, is that right? So that one possible distinction aside, on every single other occasion where something had gone wrong, the clinical staff had put their hands up, is that right?
Yes, without fail.
At any point during all of that and thinking about all of the things that you faced, did you ever lose trust in your clinical team?
No.
Okay, well, let's do the same exercise with the hospital managers. On the water, at any point, did they put their hands up to say there's something wrong with the water and tell you what it was?
No.
What about the ventilation? We've not really spoken about that today.
I don't know what's wrong with that.
I mean, did anyone ever say anything about there being an issue with the ventilation that you recall?
That it was in backwards.
What about in the falling windows? Did you feel that the hospital put their hands up in relation to that?
No.
The cladding?
No, not really.
On the question of whether immunocompromised children would be safe in an adult ward, did you feel that the hospital offered full and candid explanation on that matter? On the duration of the move to that ward?
No, that continues to change.
What did you say there, Molly, sorry?
That continues to change.
And maybe just overall, on the history of infections in the whole of the hospital, do you think that to this day, the health board have put their hands up and given a full and frank explanation of what the position is?
Not at all.
What was the effect of you, what was the effect on you and other patients on these deficiencies that you've described in relation to communication?
don't feel safe. I feel like the building itself is sick. That's where you're supposed to go to be made better. And you don't have an option. It's not just something that you can think, oh, it'll go away itself. You have to go. But you're left there not feeling safe.
What about the effect on the staff?
The amount of staff that left, good staff that left, it was horrible. And some of them used to, they'd be sitting crying. And that's horrible to watch.
I mean, sitting where you are today, I mean, we're thinking about your perception of things. Do you think that the NHS GGC gets this? Do you think they're starting to understand?
No.
I mean, in your statement, in paragraphs 175 and 176, say something about communication in relation to the Oversight Board report. Do you want to have a quick look at that, Molly, just to remind yourself of what you've said?
Yeah.
You want to summarise the issue that you're describing there?
So when the overview report came out, there was a letter sent to every family that had a patient since 2015. Over 400 families, I believe. And it was the exact same letter that was sent to current patients that were out of treatment, families of those patients that had passed away, and patients that were over 18. And it was the exact same general letter talking about a child in the present tense that is going through treatment. Now, I was put out that they were talking to me about my child, bearing in mind that it was me that was the patient. That is nothing compared to writing a letter to a parent that has lost their child and talking about said child in the present tense as if they're still going through treatment. It's a kick in the teeth. It's just they're not thinking that's four categories of people. Even if you're going to send the same generic letter, at least send 4 different versions of it. And so I took issue with this, and there's a closed Facebook group, and I made it known how I felt about it, that it was a poor generic letter. And I did get a response, but there was also, there was a parent of one of my friends that passed away, and she was really upset about the letter. We'd lost him, and that's not something you want to live through, with them not even caring that the way they've written it. And eventually I got a letter addressed to myself from the chief executive apologising, but that letter itself was inappropriate because it was the whole end of the letter was hoping I was okay in troubling COVID times, as if that was the worst thing that possibly be wrong in my life. Not the cancer or the infections or anything. It was COVID. That was the most talked about thing in that letter. It was just poor. They just didn't get it.
This is not just a story of poor communication, as you describe it. There are also actual impacts on you. And I think the way you put it in your statement is you have suffered avoidable impacts as a result of the condition in the hospital. Is that right?
Yeah.
And presumably emotional impacts, that too.
Yeah, I have to meet with my psychologists. Hopefully every week, if not at the most every 2 weeks.
So if we conclude the story of the hospital so far, Against this background that you've described, Molly, I'm going to ask you this question. It's not something that's dealt with in your statement, but just thinking about the story of the hospital so far, would you say that's the story that involves delivery of the highest standards of healthcare in a state-of-the-art hospital?
I don't think it's a state-of-the-art hospital, no. I think it's the highest standards of healthcare from
Yeah.
the clinical staff, but it's a world-class team, but not in a world-class hospital.
Okay, let's uncouple the story of the hospital from your story. Let's go back to your plans. So you got your hires and studying physiology in second year, did you say?
Yeah.
And that's at Glasgow University, is it?
Yes.
And are you involved with the Anthony Nolan Trust there?
Yes. So the best age range to recruit people to the stem cell donors list is from university age. And so Anthony Nolan have student-run branches in the main cities across the UK, and I'm on the committee for Glasgow's group. I'm on the exec committee. I'm in charge of I'm the volunteer coordinator and the secretary, so I effectively do admin. But I also am in charge of training and making sure that all the right stuff's done with that and everything's set up properly so that we can fundraise and recruit people to the stem cell donors list.
Yeah. And you've spoken a few times now about the Every Thank You Counts charity and the ball. And remind me, was that in October 2019?
Yes.
And 330,000?
Yeah.
And that's contributed to a blood analyzer, is that right?
Yeah. So there's a specific one. There's one in A&E and there's one in PICU, but now we have one specific for us as well. So blood doesn't need to go through the hospital's general system, so it comes back quicker and it analyses it quicker. And I mean, we need our blood cell counts really fast.
Is there any issue around that presently? About the speed within which
so
blood is analysed?
Before the machine's there now, but before you could be there for hours just to have your bloods done, and that's taking up a room, but it's also taking up the staff's time. But it's not nice for a patient, and sometimes by the time that the blood actually gets through the system, it's clotted, so they can't actually test it. So then you need to get your bloods done again.
And another thing I noticed that your fundraising efforts had gone towards was a relief facility for the PQ staff, is that right?
Hopefully, yeah, that's the next challenge.
Right. Do you want to tell us a bit about that?
So we felt that the best way to offer support for PICU, so both Sana and I were patients in PICU for a long time, and the staff work tirelessly in there. And unlike any other ward, when they're on call, they can't actually leave the hospital. So they're there for all around the clock, basically. And so we thought the best way to support patients was actually supporting the staff, and have somewhere that they can go and even just lie down, or even the kind of lazy boy chair things that they can just sit back and relax on their break, and have somewhere maybe that there's a fridge or something. But just if you're looking after the staff, then they're going to look after the patients better. And that's probably the best way that you can do that. So that's the next challenge.
And then we go back to really where it all started. The one thing that set the ball rolling on this work, which was the
room.
The room. And is the room being completed?
It's about, there's still things that have to be put in, like the TVs and the gaming screens and stuff, but it's essentially done, yeah.
Do you know when it's going to open?
It'll open when the ward opens, so I believe it might be 6 to 8 weeks. I don't know for sure. I don't know a real date. extends all the time, so just whenever the ward opens.
Yeah, you don't presently know when it's
No, I
planned
don't
to
have a
open
date.
the Alien unit.
No.
Molly, I've run out of questions at long last for you today. Is there anything you want to say before you conclude your evidence?
I think the biggest thing to point out is that what I think's been forgotten along the way with how management and indeed the health board have dealt with things is that it's not a normal job where if mistakes are made you can just try again tomorrow. There's patients at the centre of it, and that's lives that are impacted. And I think that's forgotten a lot of the time. Even simple things like communication that could be improved, the difference that makes to a life, and how much easier that makes it for someone. Because it's hard enough to go through cancer treatment, never mind throwing everything on top of that and then having to worry if where you're getting said cancer treatment is safe or not. Now, that's ruined for me, that's tainted, and I don't know if that'll ever not be, but there's new patients and there's current patients that it's not ruined for yet, and that can still be fixed. It's not an unfixable thing, it can be changed. If this does anything, if it just goes to contribute in that small way to make it easier for the next people, then I think it should. Because, like I said, I'm going to be in and out of hospitals for the rest of my life, and I'm always going to rely on them. And unfortunately, I don't trust them the same. But it doesn't have to be the same for everyone.
Thank you, Molly.
Thank you very much, Ms. Cuddihy. That's, as you will have gathered, the end of your evidence. But thank you very much for coming. Thank you for providing a full and useful witness statement. And thank you for answering questions. But that's your evidence over. Thank you.
Thank you very much.
I understand that we were perhaps more successful in live streaming this afternoon than we had feared. So if anyone was anxious on that score, here's that I can reassure them. I think, plan to sit again tomorrow at 10 o'clock, Mr. Duncan?
Indeed, my lord. We have one witness lined up for the next 2 days. I don't really have a good feel for how long his evidence will take.
Well, we shall adjourn until tomorrow at 10.